Hi, this is Dr. Chris Wilson with Think PT, here today to talk about ankle range of motion. In particular, we're going to talk about ankle dorsiflexion, or the motion where we bend our lower leg, our tibia, over the ankle here. All right, that's our dorsiflexion. For a lot of people, that range of motion is limited. Actually, it's a little limited in me, thanks to some chronic ankle injuries. But there's some things that you can do to help counteract any kind of limitations you have there. Certainly stretching, strengthening appropriately both the front of your leg and the back is good, but a nice little drill that I'll have some of my clients do. Right, that's not going to work. Dr. Chris Wilson with Think PT here. Today we're talking ankle range of motion, dorsiflexion in particular. What that motion is it's taking the lower leg, your tibia, over your ankle and your ankle here. Hi, this is Dr. Chris Wilson, physical therapist with Think PT, talking ankle range of... Hi, this is Dr. Chris Wilson, physical therapist with Think PT. Today we're talking about ankle range. Hi, this is Dr. Chris Wilson, physical therapist with Think PT. Today, we're talking ankle range of motion. In particular, dorsiflexion. So that's the lower leg over your foot and ankle complex. All right, with chronic ankle sprains or other kinds of injuries, or just general lack of mobility, a sedentary lifestyle, we can lose some of that range of motion there. In fact, for me, it's a little limited because of chronic ankle sprains when I was playing soccer as a younger athlete. The good news is there's a lot of things that you can do for that. Certainly stretching can be beneficial, both your gastroc and your soleus, the two parts of your calf muscle, as well as doing some strengthening for your anterior compartment and your posterior. In addition to that, some joint mobility exercises are very handy, and there are things you can do on your own. I like to use these rubber bands here. These rubber bandits are functional fitness bands. A lot of people use them for pull-ups or those kinds of things, but if you just get it there underneath your foot, and what you want to do is have it, get it at an angle as best you can, so it's going to be pulling down underneath your actual ankle bones. As best you can, it's not always perfect here, but you'll get some stretch on it. And again, if you watch, I'm just going to take that down. We can do it that way, or come in here, we're just going to come there. So we're pulling, it's going to be pulling what's called the talus, part of your ankle complex, back, gliding it back to allow your tibia, your lower leg, to come forward a little bit more. All right, so I just got nice tension on there, coming forward, keeping my heel on the ground there, just nice and easy. Working that ankle range of motion. This is important for walking, it's important for day-to-day activities, and if you don't have it, it can cause problems all the way up and down the chain, from your ankle to your knee to your hip. It's a nice little drill that you can do on your own. Again, it's not medical advice. We're just talking some general education, things you can ask your healthcare provider about, or come in and see us today. Again, this is Dr. Chris Wilson with Think PT. Thanks so much.